pull-up. In this video, I'm performing a pull-up. A pull-up is an upper body compound movement that requires the coordinated action of several anatomical structures located above the pelvis. These structures include the bones of the upper limb and shoulder, the joints that connect to them, and the muscles that produce and control the movement. During the exercise, the body is lifted vertically by pulling against a fixed bar using the arms and back muscles. The main bones involved in a pull-up are the humerus, scapula, clavicle, and the ulna. The humerus is the long bone of the upper arm, and it plays a major role in shoulder and elbow movement. The scapula or the shoulder blade sits on the posterior side of the rib cage and acts as an attachment point for many muscles that stabilize the shoulder. Clavicle, also known as the collarbone, connects the scapula to the sternum and helps maintain the position of the shoulder. In the forearm, the radius and ulna form the lower part of the arm and articulate with the humerus to create the elbow joint. These bones work together to allow movement and provide attachment points for the muscles responsible for the pulling action. Two primary joint structures are responsible for the movement in a pull-up: shoulder joint and the elbow joint. The shoulder joint is formed between the head of the humerus and the glenoid cavity of the scapula. This joint is classified as a ball and socket joint, which allows movement in multiple directions, including flexion, extension, abduction and adduction, and rotation. This large range of motion is essential for movements such as a pull-up, where the arm must move through a large arc while supporting body weight. The second major joint involved is the elbow joint. This is formed between the humerus and the ulna, with assistance from the radius. The elbow is classified as a hinge joint, meaning it primarily allows movement in one plane through flexion and extension. During the pull-up, this joint is responsible for bending the arm as the body is pulled towards the bar, and then extending again as the body is lowered back towards the starting position. The movement of a pull-up can be divided into two main phases: the upward or concentric phase, where the body is pulled towards the bar, and a lowering or eccentric phase where the body returns to the starting position. During the upward phase, several joint actions occur. At the shoulder joint, shoulder adduction and extension take place as the arms move down towards the sides of the body. At the elbow joint, elbow flexion occurs as the arms bend to lift the body up. The latissimus dorsi acts as the prime mover for the shoulder adduction and extension. This large back muscle generates a significant amount of force to pull the upper arm downward and bring the body closer to the bar. Assisting the latissimus dorsi are muscles such as the teres major and the posterior deltoid, which help to contribute extension of the shoulder joint. At the elbow joint, the main muscles responsible for elbow flexion are the biceps brachii, brachialis and brachioradialis. The biceps brachii is often considered the primary elbow flexor during pulling movements, while the brachialis lies underneath the biceps and contributes significantly to elbow flexion strength. The brachioradialis, located in the forearm, also assists in bending the elbow during the pulling motion. During this upward phase, these muscles perform a concentric contraction, meaning they shorten while producing force. The shortening of the latissimus dorsi pulls the humerus downward towards the torso, while the elbow flexors shorten to bend the elbow and raise the body. Another important component of the pull-up is the movement and stabilization of the scapula, or the shoulder blade. Muscles such as the trapezius and rhomboids are responsible for scapular retraction. This involves pulling the shoulder blade slightly towards the spine. These muscles play an important part in stabilizing, ensuring that the shoulder joint remains in a strong and stable position whilst the body is lifted. Throughout the movement, the core muscles also contribute to stability. Muscles such as the rectus abdominis and the transverse abdominis contract isometrically, meaning they produce force without changing their length. Their role is to stabilize the trunk and prevent excessive swinging of the body, allowing the upper body muscles to generate more force efficiently. Once the body reaches the top of the movement, the exercise enters the lowering phase. During this phase, the same muscles remain active, but they perform eccentric contractions. An eccentric contraction occurs when a muscle lengthens while still producing tension. Instead of lifting the body, the muscles now control the descent back towards the starting position. The latissimus dorsi gradually lengthens to control shoulder movement, whilst the elbow flexors lengthen to control extension of the elbow joint. This eccentric control is important because it prevents the body from dropping too quick and helps maintain control and stability throughout the movement. Overall, the pull-up is a complex upper body movement that requires coordination between several bones, joints, and muscles located above the pelvis. The humerus, scapula, clavicle, and ulna perform structural framework, while the shoulder and elbow joints allow the necessary range of motion. Muscles such as the latissimus dorsi, biceps brachii, brachialis, brachioradialis, trapezius, and rhomboids generate force and stabilize the joints. This is done through a combination of concentric, eccentric, and isometric contractions. All these muscles work together to produce a controlled and effective pull-up.
In this video, I'm performing a counter movement jump. I'll be covering all anatomical structures distal to the pelvis as well as the pelvis itself. A counter movement jump is a lower body movement in which the body is first lowered and then propelled vertically by a coordinated extension of the hips, knees and ankles. 3 major joints are responsible for the movement involved in a counter movement jump: the hip joint, the knee joint and the ankle joint. The hip joint is formed between the proximal end of the femur and the acetabulum of the pelvis. It is classified as a ball and socket joint, which allows movement in multiple directions, including flexion, extension, abduction, adduction, and rotation. This large range of motion allows the hips to contribute to powerful movements such as jumping. The knee joint is formed between the distal end of the femur and the proximal end of the tibia, with the patella located at the front of the joint. The knee is primarily classified as a hinge joint, allowing movement mainly in flexion and extension, while also permitting a small amount of rotation for stability. The ankle joint is formed between the distal ends of the tibia and fibula and the proximal end of the talus. The ankle is also classified as a hinge joint and allows plantar flexion and dorsiflexion, which are important during the preparation and push-off phases of the jump. The counter movement jump can be divided into 3 main phases: the counter movement phase, the propulsion phase, and the landing phase. The first phase, the counter movement phase, occurs when the body quickly lowers before jumping. During this phase, hip extension occurs at the hips as the hips move backwards. Knee flexion occurs at the knees as the knees bend, and dorsiflexion occurs at the ankle as the shin moves forward over the foot. The muscles controlling this phase include the gluteus maximus, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, gastrocnemius, cilius, and the popliteus. The gluteus maximus acts as an agonist, performing eccentric isotonic contractions to control hip flexion, with synergists including the hamstring, which consist of bicep femoris, semitendinosus, and semimembranosus. The rectus femoris, vastus lateralis, the vastus medialis, and vastus intermedius together form the quadriceps group, which acts as an antagonist, performing eccentric isotonic contractions to control knee flexion. The gastrocnemius and the cilius together form the calf muscle group, which acts as an antagonist, performing eccentric isotonic contractions to control dorsiflexion at the ankle. The popliteus acts as a fixator, performing eccentric or isometric contractions to stabilize the knee and assist in initiating knee flexion. The second phase, the propulsion phase, occurs when the body rapidly extends and leaves the ground, performing triple extension at the hip, knee, and ankle. Hip extension is driven by the gluteus maximus, which acts as an agonist, performing a concentric isotonic contraction, assisted by synergists in the hamstrings, including the bicep femoris, semitendinosus, and the semimembranosus. Knee extension is produced by the quadriceps group, acting as an agonist, forming concentric isotonic contractions, while the popliteus acts as a fixator, primarily contracting isometrically to stabilize the knee during rotation. Plantar flexion at the ankle is produced by the calf muscle group, acting as agonists with concentric isotonic contractions, assisted by the tibialis posterior, which acts as synergist, stabilizing the ankle and assisting plantar flexion. The final phase, the landing phase, occurs when the body returns to the ground and the joints bend to absorb impact forces. During landing, hip, knee, and ankle joints move back into flexion. The gluteus maximus continues as an agonist, performing eccentric isotonic contractions to control hip flexion. Quadricep group acts as an agonist, performing eccentric isotonic contractions to control the knee flexion. The calf muscle group acts as an antagonist, performing eccentric isotonic contractions to control dorsiflexion at the ankle. Finally, the popliteus serves as a fixator, performing eccentric or isometric contractions to stabilize rotational movement at the knee and assist smooth knee flexion.